I'm going to just quickly introduce myself. I'm Savani DeBarros, the owner and founder of SL DeBarros Law Firm. I represent business owners, first generation business owners, and professional athletes. I focus in the areas of business law, sports entertainment, and labor and employment. It is my sincere pleasure to have you guys here today. So Mimi, can we start with you? Tell us a little bit about you, and then we'll get to you, Eric, and then I want to hear how you guys ended up coming together as a unit for Delos Therapy.
Yeah, great. So thank you so much for having us. It's really exciting to do this with you. It was great to meet you recently at an event for athletes, and I think that probably is the first thing I'll say. Is I come from Europe. I was a table tennis player, a competitive player. My dad coached the U.S. Olympic team, and when we moved to the United States, we lived at the Olympic Training Center in Michigan, where he was the coach, and I was there helping organize things, and I was also a player, and that's where I met Eric, who came there to train with his father. So back in the day, and Eric can fill in some of the gaps, but basically what happened is, his father developed this incredible therapy for chronic pain that was really effective at treating all kinds of people, professional athletes, business professionals. And when Eric and I met, Eric wanted to continue the work that his father had started. So as teenagers, we joked about the two of us starting this company together because, as Eric will tell you, he thought I was organized and pretty bossy. So I had a sense of maybe being good at running operations and business, and he really wanted to pursue the medical aspect of what was happening with the therapy. So when we were teens, we said, okay, I'll go to business school and you can go to medical school, and we'll get together and start our company then, and continue doing the work that your father started. And sure enough, that's what happened. I pursued studies in economics and entrepreneurship at University of Chicago, Booth School of Business, and then Eric went and did what he promised he would do, and we reconnected, found some investors, and here we are. We started Delos Therapy in 2012. We're looking at opening our 6th clinic once everything wraps up with the virus, and
right.
And make an impact.
That's amazing. So Eric, give us a little bit of background on you. One thing I thought that was pretty amazing is you completely shift gears to being a biomedical scientist after your professional athlete career. So that was pretty interesting to learn. So was science something that you've always have been drawn to and knew that you wanted to make a part of your profession?
Absolutely not. But I want to back up just one quick second.
Okay.
Where I met Mimi was actually at a tournament when she was
Oh.
about 12 years old.
Oh, wow.
And we were competing in a tournament. They usually have men's singles, women's singles, but this particular tournament, it was open singles. So men and women would compete against each other. And I was one of the top seeds in the tournament. I think it was the first round or so. And I was playing against Mimi. And she had no idea who I was. I had no idea who she was, but we were playing. And again, right, there was a little bit of a level discrepancy, at least I think there was. But she could not believe that she was losing to me. And every single point, she was complaining and just throwing her hands in the air in disgust that she's losing to me. And I kept thinking, like, don't you know who I am? I mean, like, you have no chance against me. And but then I went over to her dad, who later became my coach. And that's actually when I first met her. And then we became friends. Her dad eventually became my coach and transformed my career. And then we talked about going into business together. It was more of a joke than anything. But 25 years later, that's essentially what happened. But I never thought in a million years that I would go to school. I was always raised as an athlete. Table tennis was always number one in my life. My father was very passionate about table tennis. He always wanted me to be on the national team, win the U.S. championships. I always knew that I would probably go into the therapy, but I never really thought that I would go to college or graduate school or any of those things. But the more that I took a deep dive into the therapy, the more I wanted to understand.
Okay.
And my father's a brilliant engineer. He was able to think outside of the box because he had no medical training himself, and he had a lot of pain. and using that engineering mind really figure things out. But it inspired me to get the answers, to apply the engineering principles that he had, but to get a little bit more science, anatomy, physiology, biochemistry to really put those things together. So that was the direction that I took when I enrolled in college, went to, got a master's degree in biomedical science, ended up going to medical school and started the company with Mimi while I was in medical school. And my passion just became overwhelmingly in the direction of Delos and what we were already doing. And so I took a leave of absence from school to really figure out what I wanted to do and what direction I wanted to go, and ultimately ended up withdrawing and pursuing my passion.
Now, because this is pretty difficult, because one thing that I ended up doing, I was working on my master's when I got accepted into law school. So I finished up my master's during the first semester of law school, and it was a lot. So how in the world were you able to start your own business and deal with the rigors of medical school? Because, man, I mean, you guys, there's a lot that you have to go through just to get to that point, but then it's definitely a marathon to stay there, and to be able to really immerse yourself into all the things that you have to learn to get you carried over to the next level. So did you find any particular hardships that you faced while you were starting this business, or did it just really give you the foundation that you needed to push you further into Delos Therapy?
Yeah, I actually think hardship is probably an understatement. There are very few people that start a business while they're in medical school. It was definitely overwhelming for sure. But you can't go away from your passions. When you're passionate about something, it drives you.
Right.
You're almost like your passions select you and push you in that direction. You can't hold them back. So even though I still had responsibilities in medical school, I still had a responsibility to my passion. It was so intense and the drive was so much, even with Mimi, that I was trying to do both for a very, very long time. And ultimately, it actually became very, very difficult where, we had a fully operational business. When I was in my fourth year of medical school, we had 4 therapists working. We had we were patients, and when we were up and running, we were growing, things were exciting. And when I was in the hospital in medical school rotations, it was very difficult to look after the patients at Delos. It was very difficult to continue working with the therapist, and my time was very, very divided. And the hours and the pressure and the stress were pretty overwhelming at times. And so that was one reason why I took a moment to take a step back and really reflect upon what did I really want long term. Yes, I devoted a lot of time and money into the studies already, but that can't sway my decision on what I would do moving forward. And my passion is Delos, and I decided to go in that direction.
So, Eric, that is amazing, because just taking your experience and talking about your passion and knowing that your passion led you to your purpose, which is Delos Therapy, that essentially birthed this entire movement. And I call it a movement because I have experienced the services of Delos Therapy. And I have my package sitting on deck, ready to come back as soon as COVID-19 is over, okay? So, I mean, like, it completely birthed an entirely different movement of therapy, because I have not experienced anything like it until you guys put your hands on me, period. And so I want to talk about and shift gears a little bit about what type of therapy services Delos provide. And I believe we do have a video to kind of break down some of the things that you guys do, but give us a really quick take on the type of services that you guys provide, or who you provide services to.
Yeah, so I would say the missing link in medicine is really understanding that from a muscular perspective, that as we age, tissue gets stiffer and stiffer. When you feel healthy muscle tissue of children, muscle tissue that have no physical limitations, what you'll notice is those muscles are very soft and they're very spongy. Now, when you flex, a muscle should be very dense. It should feel hard, but in a relaxed state, muscle tissue should be very soft or spongy. We call that pliable. Now, through years and years of wear and tear, stress, diet, there are so many things that cause this pathological process of essentially scar formation inside of the muscle. Now, what's tricky about that is none of it shows up on imaging. There haven't been any imaging modalities, MRI, CT scans, X-rays, don't pick up those subtle changes that are happening inside of the muscle. There's some pioneering techniques with ultrasound that are kind of coming to the surface, but right now there's no real good imaging modality to see this chronic stiffness. And so patients are having all kinds of back pain and knee pain and neck stiffness, and they're getting MRIs. And I see these patients on a daily basis. They're coming in and they're saying, my MRI was totally negative. Nobody found anything, but my back is killing me and no one knows what to do. This is something that we commonly see. Now, the three most common things I hear on a daily basis for patients trying to get rid of these areas of stiffness is stretching, foam rolling, and deep tissue massages. So it's nice to know that people are starting to at least think that there's a muscular component to this, because it's for sure a muscular component. But the problem is these scars, these patterns of tightness are very complex, they're three-dimensional, they're far, far, far below the surface. So anything that's gliding across the surface of the muscle, like gliding, stroking technique, like a massage, a foam roller going across the top, none of these are actually penetrating deeper parts of the muscle.
Okay.
So my father figured this out as an engineer, that his stiffness didn't really change with a lot of stretching and a lot of massage.
Right.
And that.
Okay. And I'm sorry to cut you off, because pretty soon we're going to show you guys a video of this, because I wanted you to hear it from Eric first, so then when you see it, you'll understand exactly what he's saying. So Eric, tell us, or Mimi, either one of you guys, who do you normally work on? So you guys are former professional athletes. I can't put myself in the professional category, but I'm a former athlete. And I do notice a huge change in my body and my muscles, especially from when you stop competing on a more frequent level, to when you just become an everyday professional. You go and you do whatever it is that you do throughout the day. You do feel a change in your body and a shift somewhat into your muscles. So who do you guys normally serve? Is it athletes in, more regularly, or is it a combination of different people?
I can answer that. So, just because we have this background in sports, and I actually have a background in working in the fitness industry for many years prior to Delos Therapy, we've been fortunate enough that we had built a lot of relationships in the fitness industry in Chicago. So we most certainly serve a lot of people who are working out on a regular basis. We work on professional athletes in a variety of sports, basketball, football. However, everybody seems to be hurting. Muscle pain and stiffness is experienced across the board, even young people, grandparents, business professionals, people who sit at desks all the time. So we see a variety of clients. We do a lot with corporate clients. So we go to different companies working on traders and attorneys, people who, most commonly experience upper shoulder, back, neck pain from sitting on the computer. It's a broad range. Everybody gets to benefit. It seems to be a problem that affects everyone, but it has one common component that we're trying to address, and that's the health of the muscles.
Got you. So we're gonna skip over into this video, and when we come back, Eric, I want you to give us some tips on eliminating pain. So we're gonna go into this video really quick so people can truly get the visual of what you were just explaining about the muscle tissue being pliable and how rolling effects do not get rid of that pain.
Yeah, and I can talk through some of this. Basically, what's happening is when you're using muscles over and over and over, they're contracting, relaxing. And like I was saying earlier, they should be in a very soft or a pliable state. But when you use them over and over and over, gradually through an aging process, they become hard. It's actually a buildup of collagen that happens inside of the muscle. Now, this picture right here is how your muscle and your fascia should be organized in a normal, healthy state. But whenever muscles get tight, the fascia inside of the muscle actually becomes very disorganized. It becomes fibrotic, and you can kind of think about it like a cement that forms inside of your muscle. that cement doesn't move. And that's a pretty good indication of what it starts to look like over many, many years, if not decades, is that tissue inside the muscle is solidifying and becoming more and more dense.
Okay.
And so these are these little scars that form and they get bigger and bigger inside of the muscle. And that scar, that tightness will lead to dysfunction. It'll lead to all kinds of disability, pain, inflammation, restriction of movement, weakness. And many people are trying to explore all these different things to relieve that. But because the core problem hasn't really been fully identified yet, people are still searching with common techniques like stretching and massage and foam rolling. But here's a good indication of what's happening when you stretch. You're actually pulling apart healthy tissue. You're not actually stretching apart any of the tightness. Tightness is like cement and it doesn't move. You have to physically break that up with pressure. And this is what we'll see right here. And this is a good indication of what's happening with a massage or a foam roller, is simply going right over the top of that muscle. The problem way down deep isn't even changing. And so we figured out that very precise three-dimensional pressure, so pressure in multiple directions directly into that tissue, what it does is it goes right into those little scars and breaks apart that fibrosis and takes the muscle back to its healthy and pliable state. So we're literally stretching apart a muscle directly into the muscle with pressure. And that rearranges the fascia and gets everything back to its natural healthy state. And then we see patients that have all types of elimination of tightness, their strength, their energy levels, their flexibility, all of that is improved because now the tissue is in a younger version of itself.
Great. I'm going to take us back to the former screen. So we saw a beautiful breakdown of how the chemical component fascia is created, how the muscles become inflamed because of, the hardening of that tissue. So give us some quick tips on what people can do to eliminate pain, especially now that we are all quarantined and isolated over, periods of times. People are finding themselves in a situation where they're more restricted now because they're not moving as much. So what are some quick tips that you can give individuals to try and eliminate pain that they may be experiencing?
So 2 quick tips for sure that I can give right off the top of my head are make sure you're moving around. So you can actually have stiffness for 2 totally different reasons. You can feel stiff because of immobility, and you can feel stiff due to overactivity. Now they cause stiffness by different reasons, but if you're feeling stiff because you're sitting on the couch all day, make sure you're getting up and you're moving. There are a million live exercise regimens that every gym is coming out with. Make sure you're exercising and you're moving around and you're changing position. That will free up the fascia in a lot of ways. It'll keep you feeling more pliable and more loose. If you're feeling one particular area that's hurting or stiff in one very isolated area, you can think about that as an imbalance of tightness. So you might be tight in a lot of different areas, but that one spot that's feeling pain, that's an imbalance of tightness. That area, you need some type of pressure. So you can grab a lacrosse ball, a theracane, a novel, a corner of a door, a doorknob, anything that you can grab, a household object. We actually have pictures on our website and our social media where we have therapists showing people what to do with household objects. And you don't want to roll, you don't want to massage that area. You want to hold pressure directly into that area that hurts and force that tissue to separate, and that will definitely help.
You mentioned a theracane. So I saw this on your social media handle, I think it was Instagram. And I was like, that's so cool because I've never seen anything like that. And I'm always telling my husband when he tries, to massage, I'm like, no, put your fist in it.
Yeah, people have actually intuitively figured out that pressure is more effective. And I hear it all the time. I'm doing, 6 months of this therapy and that therapy, and I don't feel any better. And I grab a lacrosse ball and I dig it into my back and I immediately feel better. Now, why is that? And I stop them and I say, listen, all of the things that you're doing are fine, but grabbing a lacrosse ball and digging that into your back is the only thing that you're doing that's physically separating that tightness, and that's why you feel better. So people have that natural intuition to just dig in there. That's exactly what we do, but we do it at a very high level.
Right. Thank you so much, Eric. I know that people are going to benefit from this, and I can't wait till we get to the end of this webinar so people can figure out how to find you all, because the services that you offer are absolutely amazing, and the ambience of the offices are amazing. I mean, you feel like a celebrity when you walk into the offices.
Thank you.
We know we have a lot of entrepreneurs out here, and especially if we look into the demographics of former professional athletes who have gone into corporate America or into entrepreneurism themselves, there is a benefit to making sure that you eliminate your pain. So Mimi, can you take us through what some of those benefits are and how it can help them to perform better as an entrepreneur or just as a 9-to-5 corporate employee?
Sure. So there are kind of two different groups of professionals that you're talking about. In the case of companies who have a lot of employees, they spend a ton of money on healthcare costs. And so what we have found going into some of these companies is that preventing pain will actually not only decrease these corporate costs in terms of time away from work, time spent on surgeries or different therapies, but also in terms of productivity. When you're hurting, it's hard to focus. So we see a lot of people who have to get up every few minutes to actually move a little bit and stretch. They can't actually focus on their work because they're in pain. So companies can just save a lot in terms of financially, right? And in terms of the work that's being produced. For entrepreneurs or even solopreneurs, people who are like us right now, sitting at home, working from home, again, it comes down to productivity. If you can't focus, you can't be efficient. Sometimes you have to go take a nap, you have to lay down. We hear a lot of people who can't even sit at a desk because they're hurting so much in their back. They have to lay down. How can you possibly do your work if you're not actually able to, you know, sustain your body in a position that allows you to do it? So there are just so many costs affiliated with pain. It's the number one medical complaint. And we have found that this kind of therapy does wonders for companies and employees of all levels.
Yeah, and that's amazing because it's, you know, it's also putting yourself first. So one of the things that I just had to do for myself, because I like to say I'm still a new mom. My kid is only 2 years old, so I'm still new at this, okay? But I was not moving around athletically wise as much as I used to. And so I got to the point, I think the quarantine was the best thing that could happen for me, because I was filling my day up with the, you know, not just working, but I said, okay, this is the time now where I don't have to travel anywhere. I don't have to leave and go pick up my kid from school. I have an hour where I can work out, and I felt better. So it was also being able to practice a level of self-care, putting yourself first and saying, you know what, I'm going to make this a priority. I know I need to do this. And I think it starts there, knowing that I need to care for myself. And if you can put that, you know, on your calendar to remind yourself, it will be a benefit. You will be able to eliminate that pain and start to move around. And you may not have to go to the hospital or the doctor's office as much because you are taking care of yourself. And you said something that was very important, Mimi, about productivity. So you can function at your best. For me, I used to get a lot of tightness up in here. Sometimes I still do, but just moving around and everything, it eliminates the headaches for me, because that tension, you know, drives up here, up the neck into the back of the base of the head, and that could create some migraines. And if you're having migraines, you can't focus on anything. You can't look at a computer screen, you know, hours on end. So when you eliminate those issues, your productivity does go up and you can function better at what you do and get a whole lot more done. And so taking all those things in together, it's essential that we make sure we continue to maintain our health. It's, if not, you know, the most important, it is one of the most important things that people need to put on their to-do list. And they can also start by using Delos Therapy. So if you can't come into their office, they have the Theracane, figure out how to purchase that. I think Eric said that it's on the website, right?
Well, we have some tutorials and pictures.
Okay.
to educate folks how to use pressure as an instrument to be able to loosen up their body so that they're not rolling over it. But a lot of these tools, they can be purchased online.
Okay.
Yeah, I also want to mention that Delos Therapy has a YouTube channel where we walk people through self-treatment. They're typically, I want to say, about 10-minute self-treatment videos, and you basically choose the area of the body that you're dealing with in terms of pain and stiffness, and we actually walk you through how to self-treat at home while we're all stuck inside.
Awesome. Awesome. So you guys make sure you check that out. And so the first day that I had a complimentary session, I think it was with Mark over at the way far away office.
Oakbrook, yeah.
Yeah, Oakbrook. I woke up this particular morning and this side of my neck, I felt like I had slept wrong or something, but the pain radiated from the right side of my head all the way down to my shoulder and into my shoulder blade in the back. And it was so painful that I couldn't even rotate my head. By the time I left there, I was able to move my head. The pain, had lessened. I just felt so much more relieved. You guys do amazing work, and I know the testimonials are true, and I'm giving you all mine right now on live. So we do have a few questions come in. I want you guys to definitely go and follow Delos Therapy. You can visit them also online. Let's get to these questions. So we have one comment that says, awesome therapy. So definitely want to give you that. Boom, this therapy is amazing. And here is a question. So hello, Mimi and Eric. It's been over a decade since I've seen either of you at a tournament. I stopped competing in 2009. I've been dealing with stiff muscles and low back pain for 11 years. Doctors have told me my issue is not serious enough for surgery and have recommended pain management. Too often, this just means medication, one which was a steroid and caused me to gain weight rapidly. What can I do to improve my health and mitigate the daily pain, the daily back pain I live with? Keith Tademi? Okay. So who wants to answer?
Yeah, I'll take a shot at it. I would need to know a little bit more information to make sure I'm answering the question effectively. But assuming there are no structural problems, there are no disc problems, it doesn't sound like it was a surgical case. I always want to make sure patients know, listen, if an orthopedic surgeon's recommending surgery, you may have to go down that route. We're not saying that people should be reckless. But what we are saying is that keep your muscle tissue pliable, that any kind of muscle problem, tightness happening inside of a muscle that can cause all kinds of symptoms of pain, stiffness, limited range of motion, achiness, can make you feel miserable. None of that shows up on imaging. So it's worth a look at. It's worth thinking about, maybe this is potentially a muscular problem in addition to something else like a disc or something. Now, if it is a muscular problem, by far the most effective thing that we've seen is to apply pressure directly into that area. So I would encourage this gentleman to go onto our YouTube channel. Feel free to give me a call or email. I can walk through the process, but he needs to find areas that feel stiff, right where the areas hurt, and apply pressure directly into those areas and try to force that tissue to separate a little bit.
And so tell us too, where are you guys located? Are you only in Illinois, or do you have offices anywhere else?
Right now, we're just in the Chicagoland area. We do have some preliminary plans, thinking about expansion to California, to Colorado. We want to be everywhere. Everyone in the world is suffering with chronic pain, and there's so many people that need help, and we believe that this is a huge breakthrough. So we want to be a national, if not a global brand, and I know that we'll get there.
Right. I agree, and I think you guys could definitely make that happen, because you are amazing. You're amazing people on top of that, which is a great thing. So to answer Keith's question, and for anyone else who may be experiencing pain, you lose nothing by trying this, so you have everything to gain. You definitely lose nothing by trying this and seeing if this therapy works for you. But of course, we want to be careful in giving you somewhat medical advice and make sure that you do take the medical advice from your physician if that's what you may end up having to do. So we think.
And sorry, I wanted to add one more thing.
Okay.
I would say restoring pliability is really phase one. And something that everybody, in addition to Keith, should think about is phase two is strengthening. So you want healthy muscles that are soft and spongy, but they should also be very strong. So some kind of a strength training regimen after the tissue is pliable, those two working together can really be life-changing. But it's not effective to undergo a strength training regimen when your muscles are stiff and pliable. It's a little bit tricky because muscle tissue that's not pliable, it'll be locked up so that it'll present as weakness. And so a lot of people think that they're weak so that they need to strength train. It's actually the other way around. You have a lack of available muscle tissue because everything is so stiff. You don't have good recruitment of the muscle. So naturally you're weak, not because you're actually deconditioned, but because you have a lack of available muscle tissue. So strengthening it at that phase isn't very effective. So what we recommend is restore pliability first and then strengthen afterwards. And it'll really, really help a lot of people.
So we have another question that came in. Can Delos Therapy help with my allergies that I have now? Lots of head pain that is causing migraines.
So she has migraines or he has migraines?
I don't know if it's who it is, but they have, so they have allergies, and I'm thinking that the allergies are causing the head pain, and then from the head pain is causing the migraines.
Yeah, so I would say any kind of headache or migraines, if it's a tension migraine, migraines are tricky. They can be caused by hormonal imbalances, they can be caused by tension, they can be caused by stress, they can be caused by a million different things. But if it's been diagnosed as a tension migraine, that is something that we really, really excel in. But I wouldn't say loosening up the muscle tissue and the fascia is going to have a profound effect on allergies. I would say that's probably going to be a little bit more immune and diet related. So I would probably talk to a specialist in that area. But if there's any kind of tension, migraine, or headache, that's something that we can definitely help out with.
All right, guys, do we have any more questions before we wrap up? I don't see any more. Mimi and Eric, I want to thank you again for joining me for this webinar to talk about eliminating pain during isolation. These are tools and tips that you all can take with you, whether you're in isolation or not. This is a daily ritual, something that you should definitely put in your arsenal to make sure that you are healthy, number one, and two, that you are productive and operating at your best. It's been such a pleasure. Again, my name is Savania DeBarros with the SL DeBarros Law Firm, and I look forward to seeing you guys out here in the digital world.
Thanks so much.
Thank you.
Bye. Thank you.